everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health. I'm also a Kynector. So today I'm going to talk to you all about all of the great things that Kynectors can do for you, for your clients, how you too can become a Kynector, and also a great note about Kynect resources. So let me pull up my PowerPoint and get started. Now, in the dry run, this worked seamlessly. So here is hoping that that also happens now too. Right. Okay, I'm feeling okay. Awesome. I love the thumbs up. So today, I love the title. I am one thing about me as a Kynector, I will always use a Kynect pun wherever I can. So as a Kynector, this is connecting kids and families to community resources and enrollment assistance. And that is both tied to Kynectors and Kynect resources, which we'll cover today. So first off, let's start with with Kynectors. Who are they and where to find them? So first of all, like just a little basic background about Kynectors. I'm sure most folks have heard about them or have worked with them, met them. The Kynectors are part of the Kynector program is part of a collaborative program between healthcare providers, local organizations, and the Commonwealth of Kentucky. It is primarily overseen by the Kentucky Health Benefit Exchange, or KHBE. A lot of this presentation, there's a ton of alphabet soup in here. I've tried to make sure to spell out everything, but if I miss anything, please do not hesitate to interrupt, call it out, and ask questions as we go along. Don't need to wait until the end to ask questions. But just feel free to unmute or raise your hand as we go along, put it in the chat, and I'll respond to stuff as we go along. But there will also be time for questions at the end. Okay, so back into this. The Kynector program is a collaborative program. Again, it's overseen by the Kentucky Health Benefit Exchange. And the primary goal of Kynectors and the Kynector program is to support health coverage needs for Kentuckians. So there are two different types of Kynectors, first of all. There are contracted Kynectors and non-contracted Kynectors. They both do a lot of the same things. The real difference is that the contracted Kynectors, they also receive federal funding to hold outreach events, outreach and education and enrollment events. There's a requirement for contracted Kynectors to do outreach and enrollment events as well. And so if you as FRYSCs are ever looking for opportunities to partner with Kynectors, or you want to work with Kynectors, if you're having a community event and you would love to have some folks, Kynectors come and show up at your community event so that your families and families can meet Kynectors right there in that same room. Contracted Kynectors are a really great resource for that. Because they're already required to do those outreach and education and enrollment events. And so they're always looking for more opportunities to do that. And they're also almost always doing events all across the state basically every day of the year. That's a great opportunity for a partnership to get to know Kynectors, to meet the folks in your community, and go from there. Non-contracted Kynectors they do the same thing. They do not receive federal funds to do any of the work, to do any of the outreach or education work that they do. They're typically staff members of volunteer organizations, either public or private, federally qualified health centers, health coverage providers, lots and lots of different agencies and groups that have either public or facility-based Kynectors who either help everyone who calls and needs help with assistance, or facility-based who only help the folks who are at that facility, whether that's a federally qualified health center, rehab centers, some recovery houses. They have facility-based Kynectors who only help those clients. both contracted connectors and public non-contracted connectors. They will help anyone who calls from anywhere in the state. But the only real difference here is just that contracted connectors, they get those federal funds to do outreach and education and enrollment events. There are 3 contracted agencies in the state. Here's how they break down. There's Community Action of Kentucky, KIPTA, and then the Kentucky Primary Care Association. So that's where they're sort of, this lovely map shows where they're laid out. So if you're looking for, your local contracted local connector, here's who you'll call. I included their number, and then all of them are also linked in that. Their mission statement, CAK, KIPTA, and KPCA, they're also hyperlinked there. So you'll have a copy of these slides. So if you'd like to reach out to them, that's also right there as well. So all connectors can help Kentuckians find health coverage, assist with health coverage enrollment, and create referrals for resources. So right now, connectors can help in one of 2 ways, sometimes both, sometimes one or the other. Connectors are most connectors. There are over 330 connectors who are certified to help apply for health coverage benefits, period. So that's going to be Medicaid, qualified health plans. Qualified health plans are marketplace plans that are available on Connect. They also can help apply for premium tax credits, which are the premium tax subsidy that makes qualified health plans affordable. And then another program called KI-HIP, which I'm not going to talk about because so few people in the state are eligible for it, and it is very confusing. If you'd like more information, there is a link to it, but most people are not eligible, so we don't need to focus on that one. So most folks are either eligible, most connectors either do health programs only, so that Medicaid and qualified health plans, including APTC and KI-HIP, or the other option is to also apply for SNAP and CCAP. Now, some connectors do both. Some connectors only do SNAP or CCAP, but very, 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 very few, well, some do both. Most do health. A smaller number do SNAP and CCAP. I think the total number that are certified is like 120 or so in the state, and that has grown over the last 2 years. For both SNAP and CCAP, you can submit the application, but for SNAP, there's an interview, and so you can do an application for a client, but there is a sort of natural or not natural, there is a limit to how much you can assist a client with SNAP and CCAP. With the health programs, you can do the full application all the way to plan selection, MCO selection, enrollment, and then actually using the coverage. And those are some of the federal rules about what all connectors are allowed to do. And there is the potential for TANF being a program that connectors can assist with. That is currently working its way through approval, and we should hear something in a few months about whether or not that will be an added program that connectors can assist with. So connectors can also help residents report changes in information. So that is a big thing that we see often when folks are enrolled in Medicaid or qualified health plans or SNAP or CCAP, if their income changes, if they've got a raise at work, or they worked extra hours, or they've lost a job, they lost hours, either way. Connectors can help report those changes in a timely manner to make sure that folks stay eligible for the programs that they're enrolled in. There is a requirement to report those changes, usually within 10 or 30 days, depending on the program. And that can be a lot to ask. That can be a lot for consumers to try and figure out on their own. Going into Connect, for some people, it is very simple and they are able to sort of navigate it on their own, but there are a lot more people who it's very confusing to report those changes. And failing to report those changes can can get folks into trouble. And also, reporting those changes can help you if you apply once and then your situation changes. You want to be able to report those changes so that you can so that you can report if you're eligible for new programs and be able to get enrolled in them. And Kynectors are able to help clients walk all the way through that process. They'll do that actual legwork for them, do the casework for them, report the changes, submit the documents, which can be very complicated, even for Kynectors who we have a ton of background access. We have different ways to sort of work through the system. And even for us, we get hung up trying to report changes and submit applications and things like that. So I always recommend Kynectors as an incredible resource for clients as they're walking through trying to apply for programs, because it can be such a confusing and daunting process, and Kynectors can really take on they take on that responsibility and walk through that process for folks, and help explain how everything is working, what they need to do, all of that. So Kynectors are available in all 120 counties of Kentucky. As we saw the map before, the contracted agencies do cover all of those counties, but also there are a number of non-contracted Kynectors in all of those counties as well. And you can search for Kynectors by county, name, organization on connect.ky.gov. And there are additional filters for language, type of program, and public or facility based. And I was going to be bold enough, I'll show here in a minute, I was going to try and be bold enough to do a walkthrough of finding a Kynector live, but I don't trust my internet. So instead I added some screenshots, which we'll walk through here in a second. But just want to reiterate, regardless of whether they're a contracted or non-contracted Kynector, all Kynectors have the responsibility to educate residents about health coverage options and what that enrollment process looks like. They all are required and responsible for assisting residents with enrolling qualified health plans and insurance affordability programs like that, a premium tax credit, like Medicaid and KI-HIP. And all Kynectors are responsible for making referrals to connect residents to local community resources, including but not limited to food, clothing, banks, housing assistance, VITA organizations as well. So Kynectors are just an incredible resource. I am very biased as a Kynector myself, but they're an incredible resource that can really help people understand what benefits they're eligible for, what supports they're eligible for, and then also not only walk them through that process, walk through that casework, but also connect them to other resources as well within the community. So all Kynectors, their duties, we agree to act in the best interest of residents. So we have to provide fair and impartial information to folks who are seeking applications to enroll in qualified health plans. We can't say, hey, here are 4 plans, this is the plan for you, but we can give residents all of that information to help them just make that decision for themselves. Or help explain all of the terms, help explain how the insurance works, so that residents feel empowered to make those decisions for themselves. Some of the additional duties, verifications. So like I said, Kynectors assist with uploading required verifications. So when you apply for programs, often the state asks for information to verify the stuff that you put on your application. Kynectors can take on uploading those documents to the self-service portal to satisfy those requests for information. There's also case maintenance. So, if you've ever worked with clients, often I think you'll know that they don't usually just come in once and then they're done forever. There's often other needs that come up, other things that pop up that need to be addressed. That's the same as a Kynector. There's ongoing casework, whether that's because things have changed, your situation has changed, all of those things that I mentioned. Maybe you moved, maybe income's changed, maybe someone in the household has changed. So, all of those things, that is ongoing casework that connectors do for their clients so that they can make sure that they continue to receive the benefits that they're enrolled in. There's also reporting. Only contracted agencies are required to do like the event reporting and things like that, but even non-contracted connectors are required to report the number of applications that we do, the number of calls that we take, the number of hours that we spend on enrollment assistance, all of those things. And we report those to the Kentucky Health Benefit Exchange, who, again, they monitor all of this is under their purview. And then they report that out so that they can say, hey, did you know that in 2023, like 30% of folks who enrolled through Connect were assisted through a connector? Well, that's pretty cool. And it's because of connectors like myself and others who were able to lend that assistance and make sure that folks were able to get enrolled and connected to the programs that they needed to be in. So duties of connectors, let's move on. So if you need to find a connector, again, we've already established they're an incredible resource. I'm just really going to drill down on that. They're a really great resource, and they're a great, wow, sorry, lost my train. Connectors are a great resource, and the way to find them is on connect.ky.gov. Now, that title at the top is hyperlinked, so if you click that, when you get these slides, you can find it right there. But you can also go to connect.ky.gov, and there's a little tab on the top that says Get Local Help. When you click that, if you see that in this little screenshot, when you click that, it'll take you to a screen that will take you to this Find a Connector Agent screen. So you can see, you can search by name. So if you met somebody at a conference or somewhere and they told you their name, and you want to go back and find them so that you can refer a client to them, you can search for them that way. Or if you just want to find a connector in your county or in a county that you serve, you can find them that way, or again, by organization as well. And when I searched, I am in Franklin, Frankfurt. So I search for Franklin County, and this is what it pops up. So it shows you a map of where those folks are. You can zoom in and out of that, of where the connectors are located. You can zoom in and out, but then it also shows you a list. And so in Franklin, there are 12 connectors that are available. And Carol, she is that first person. She's with the Kentucky Primary Care Association. So hers just happens to be the first one that pops up. But you can also sort by, and if you scroll down, this is why I wanted to do a live one. But again, I don't trust the internet. Maybe if we're feeling bolder later and somebody really wants to see it, we'll do it. But you can scroll down. There are 12 results here, and when you pull it up, it'll tell you the connector details. So there, right there is the phone, email, and the name and working hours. So that's the basic stuff that you need to reach out to folks. But you can also sort by languages. Connectors have been able to put in the languages that they speak. So for folks who are bi or multilingual, you can search for specific languages. You can search for availability. If there's a particular time of the day that you're looking for, the qualifications, it's weird that they put it that way, because that's actually the public or private, that's public or facility-based, connectors. And then you can also search by program that you need assistance with. So like I mentioned, connectors can either do the health programs, or they can help with health and other programs. And those other programs are SNAP and CCAP. So if you need someone who can help with SNAP or CCAP, you would click other programs. If you need someone who could help with health, you would click that health program. And then I wanted to highlight that qualifications part. Again, the public connector or facility-based connector, it's a weird distinction that they just changed because it used to be public or private, but it's really, so public connectors, again, they can assist with anyone who calls in and asks for help anywhere from across the state, but facility-based connectors can only assist the folks at their facility. So if you're calling a federally qualified health center to talk to their connector, they're only going to serve their patients. And so, that's something to know. If you look for facility-based connectors, there is a time and a place for that. Sometimes, it makes perfect sense. If you, for example, if you already know that that child or that family goes to that federally qualified health center, then making sure that you choose someone that's already there just simplifies the process for them. But for most times, you're just going to look for a public connector, and that can get a little tricky for folks. So just wanted to make sure to call that out. So training to become a connector, it is, here's the official guidelines for it. To become a connector, you have to be a staff member or volunteer of designated organizations that must be trained and enter into the agreement with KHBE. Basically, these are the only types of facilities that KHBE typically approves to become CAC organizations, and the organization has to become designated to be a CAC entity before you can become a connector. Now, this part for me is very important because I want to make sure to talk about training to become a connector because FRYSCs already do so much work with their families and children that they work with. They provide so much assistance already, and there is a very big overlap between what connectors do and how connectors help clients and residents of Kentucky and what FRYSCs do. Partnership is totally is a completely valid option if you are not friends with the connectors in your area already. Please, I 100% recommend becoming friends with your connectors because, again, they can be an invaluable resource for you as you're serving folks. But we also need more connectors. We just do. We need more folks who are interested in being able to be trained and maintain their training so that they can help folks enroll in healthcare and the other programs like SNAP and CCAP. One of the big upsides for me of all of this is being able to do that casework for folks and be that centralized sort of hub of resources. I think both FRYSCs and connectors know that when clients come to you, they're not often just coming for one thing. Clients need have many needs that arise, even if they're coming to you just over one thing. And so there is already a lot of overlap between FRYSCs and connectors. And so it feels like a natural extension to maybe take on this extra role. But I don't want you to go into it blindly. So let's talk about what training looks like. So, like I said, organizations must be approved as connector entities. They're CAC entities or connector agencies prior to anyone getting trained. And so that is an application that I've linked below. And the organization has to be designated first. And then once the organization is designated, there is an initial training that is about 20 hours of content. Now that goes over all of the nuts and bolts of health insurance. So if you're familiar at all with health insurance, if you have, any sort of passing knowledge of it, it can be, that 20 hours is a little bit shorter. If you're familiar with copays and deductibles and coinsurance and how all of that works, that 20 hours can be a lot shorter. But if you're totally new to it, if you have never heard of a copay before, if you don't know how any of that works, it might be a little bit longer, but on average, it's about 20 hours. And it goes into all of that content. So what are all the nuts and bolts of health insurance? What are copays, coinsurance, deductibles? How does health insurance work? How does the enrollment piece? It walks through what the application looks like, how to do the application, how to do the calculations. It has many reference guides for any information that you might need to know about doing a Medicaid application, understanding how the system, how Connect works, and how the different pieces of Connect work with each other. So it's a very in-depth training, and after 20 hours, I genuinely do feel you are prepared to start doing Medicaid applications, start doing health applications. The training for SNAP and CCAP is about another 5 hours a piece. So again, that goes into the nuts and bolts of that program, and it stops at the application process because there are limits to how much connectors are allowed to help with both of those programs. But it really is a pretty in-depth training, and it will train you for the most middle of the road, generic, straightforward situations. Once things get a little complicated, if a household is slightly different, it does take a little bit of practice, sometimes conversation, to figure out what it is that you need to do or what the best way to do. But most of that is just decided by Connect, by the self-service portal. So connectors use Connect. I feel like that connectors use Connect to do those applications, and Connect, it does a great job of making those determinations sort of automatically. But it's really important to have that knowledge base, because sometimes there are errors. Sometimes information is put in not the way that it should be, and it makes a big difference on that eligibility determination. So it's super important to have that 20 hours of training on content. But once you've got it, and once you start doing it, it really does become second nature. It really does become very easy. At least it becomes a lot easier. Let me not say it's easy. I still have been doing this 3.5 years in Kentucky, 6, 7 total as an assister. And there are still things that I run into problems like, wait, why is this happening? I don't understand. But truly, most of the time, it is a small error that you have to spend that time tracking back to something, whether that's on our side, Kynector put in information incorrectly, because that does happen. But other times it's the system that's interpreting information incorrectly. So understanding eligibility is super important. Understanding, those guidelines for program eligibility is also super important. But again, once you know those eligibility guidelines, it becomes pretty second nature, and you become better and better at being able to spot out, like, oh yes, I think you tell me your income and your household size, and it's like, oh yeah, I think you're probably Medicaid eligible, or I think you're qualified health plan eligible, I think you're SNAP eligible, I think you're CCAP eligible. So that's a really great skill and tool to have in that tool belt, especially as you're making other referrals and looking at the bigger picture of what your clients need. And if health is one of them, being able to make that quick assessment is super helpful. And then making that connection to a connector if you don't want to become one, which is also valid. There are, like I said, recertification. There's an annual recertification that's every fall right before open enrollment. So that usually opens end of August and is required by like October 15th. Sometimes a little bit later, but you do have to do that annual recertification. That one's only about 4 to 5 hours, but you can do the initial training anytime during the year, and be good to go. But and be good to go. There are now monthly KHBE meetings with Kynectors just to share issues, report problems, ask any questions. So there's that monthly touch base where, if you do become a Kynector and you need you run into a problem or an issue, you can always reach out to them either during these meetings or by email, and they'll also be able to help. So if you're interested in training to become a Kynector, here's the application for your organization. But if you just have more questions and you want to talk through a little bit more about what that day-to-day looks like, you can always come off mute here, but you can also reach out to me directly, and there's my email as well. Okay, so let's hop into Kynect resources. I'm going to do a quick run through of some of the highlights of Kynect resources. So there we go. The little bar of sharing my screen is constantly in the way. So sorry, bear with me for 1 second. Okay, so Kynect resources. So basically, Kynect resources allows residents to browse community programs and services to help with all of the needs like food, housing, and employment. It also allows residents and community partners and state agencies to work together towards a better Kentucky. That's the overall mission and goal, and it makes it really easier. It's making it easier than ever for residents to connect to help and additional resources. So let's go through. All right, here we go. So, all right. So Kynect Resources itself is a directory of programs, services, and supports that are available throughout the Commonwealth. And it's in partnership with United Way 211. And so it has built-in tools for users to help facilitate connecting residents to the supports and making referrals to different organizations. Kynect Resources was developed with the primary mission of bringing together community partners and Commonwealth agencies into a comprehensive single platform that connects Kentuckians to their services. I'll say Kynect Resources has been slowly developing. There have been a lot of problems when it was first rolled out, just not a lot of uptake, not a lot of closing referrals. But the state has worked really hard over the last couple of years to improve it and make it a more seamless program, make it a more seamless platform. And so it helps reduce barriers to finding help because all of those community organizations are all listed within that one place within Kynect. There are it makes faster connections because again, it's all in this one-stop shop, this one central place where you can make referrals, you can look for referrals, and then share information as well, share referrals as well. Great. Okay. Sorry, I just noticed that there were chat, making sure I didn't miss anything. So the Kynect resources also, there's a closed group referral process. So it makes sure since we're all in this one same little bubble, we can make referrals to each other. And then there's now some follow-up from United Way to follow up with any community organizations that don't close referrals. And so that used to be a big problem before, but now United Way is much more involved in it. And so they're able to help make sure that those referrals actually do get closed by the organizations that are being referred to. It also collects insights and key metrics about social determinants of health, and Kynect Resources has an incentive initiative for nonprofit organizations, which is pretty cool. So of course, a referral is a request for help. And this is just walking through this process of how that works. So a community partner works with a resident who needs services. They use a GED, services for obtaining a GED for this example. In that conversation, the resident shares that they are only working part-time. They struggle to pay utilities. So the community partner gets onto Kynect Resources to find an organization that provides utility payment support. And creates a referral into that organization within Kynect. The organization receives an email from Kynector Resources notifying them of that referral. Then the organization logs into Kynect and contacts the resident. The organization then provides the resident with the resource, and the organization closes the referral and Kynector Resources. So from the community partner, they make that referral, the referral agency, they open that referral, call the person that needs the help, give them that resource, and close it all within Kynect. So that's that closed loop. It's supposed to make it much simpler and easier to make sure that folks are getting the help that they need. So as I mentioned, there's also the social determinants of health piece. Kynector Resources collects and shares SDOH information to provide a holistic view of residential needs. There's also going to be an update in July where the Kynector role is now tied to Kynector Resources. So as a connector, we'll also be able to look into Kynect and make those same referrals for our clients, and then see what referrals have been made, as well as looking at these, along the left side, there's the risk factors from that social determinants of health. We'll be able to, see they're using a red, yellow, green light system for how for stable, vulnerable, or in crisis and during that assessment. And so as connectors, we'll also be able to see this and make referrals within Kynect as well. It'll be tied to that dashboard. So that'll be really cool to make sure that all of these pieces are tied together. Yes, Quentin.
And Priscilla, we've got a question in the chat from Eric Adams. He says, where's your favorite place for the FRYSCs to advertise information on becoming a connector? Or what have you noticed has been the best audience for recruiting people interested in the past?
That's a great question. Honestly, the best way that we've seen so far is direct conversation. We've sent out emails. I know that KHB has sent out sort of recruiting emails. Some of our partners, especially at contracted agencies, have sent out emails about becoming connectors. For me, my best follow-up, my best success in actually getting someone involved in becoming a connector has been like self-interest driven. I've talked about becoming a connector and just shared the information more broadly, and the folks that are actually interested in it kind of find me, because I get it. Like, not everyone wants to be a connector. Not everyone has the bandwidth or interest or all of that, and there's so much that it does take. Not in the, training is pretty minimal, but the actual being a connector, the casework, the follow-up, the support, all of that does take a lot. And so, I don't fault anyone for, not wanting to do that. But email is great. Social media is great. I, share stories of like connector wins sometimes. And that's, yes, shout out to Kelly. I like to share examples of like connector wins of the things that we've been able to do, of the clients that I've helped. And that is typically the thing that, some people relate to. They want to be able to do that for their community. They want to be able to do that for their organization, something along those lines. So that in-person, if you know someone, if you're thinking about someone, if you're, as I've gone through this, if someone popped into your mind, like, I wonder if they would like that, I would just directly point that out to them. Like, hey, have you thought about this? Why don't you talk to to Priscilla? She can walk you through exactly what that would look like. And I think that would be a great idea. Not to put myself out there, but yes, I'm happy to have that conversation with anyone. Okay, so back into this. Moving forward. Okay, so organizations by county, there are currently about 6,700 organizations listed in Kynector resources across the Commonwealth. And this is as of beginning of April. So there's lots of different organizations and they are working diligently to continue adding more. So around 19,000 individual resources listed in Kynector resources right now, which is only growing by the day. So again, a great resource. And here's how all of the different pieces come to play, and really how stakeholders benefit from this. But it really is, it's bringing together all of these different groups to make sure that Kentuckians are getting access and referred to the resources that they need. And you can find it here at kynect.ky.gov/resources. And then here's just a little bit of the walkthrough of what that screen looks like when you go into it. You can, I don't want to walk through all of it, but, you have your partners that you can search for, browse and search results and connect with different organizations. They're all listed out on the right side. You can search by category for organization or type of assistance that's needed. And so it's a, lots of different resources to search by. Okay, so, and then the last thing that I will plug is our KY loop. Now, KY Kynect Resources is great for making direct referrals to organizations for direct assistance. For KY Loop, we post a lot of resources for actual assisters. So FRYSCs, CHWs, Kynectors, legal aid, things that you need that would help you while you're helping clients, whether that's one of our wonderful explainers on some of these different programs, Medicaid renewals, special enrollment periods, SNAP explainer, just what that program is like, what that program is, how it works, the reporting requirements explainer, child care assistance explainer, KTAP, just really good resources for handing out to clients to explain what some of these programs that I've talked about throughout this presentation are. And those are all listed on our KY Loop page. We're also reformatting our forum page to be an FAQ space. So if you have any questions about programs or things that have popped up while you're assisting clients, that is a good place to post your question. And we have a team of subject matter experts, our super users, that we ask those questions directly to and then post their answer. And so, we like to think of it as learning together. If you have a question about how something works, you're likely not the only person in the entire state who has that question about how that works. And so once that question is asked, we like to make sure that it's available for other people to find and read and be able to search for as well. So those will be sortable by topic as well. And so, yeah, that's also a good resource as well. And with that, I am done. Are there any questions with 10 minutes to go? Oh, let's stop sharing. I can happily sit in silence and just stare at it.
If anybody's got any questions, feel free to share. We'll give you just a minute there, and then if there's no questions here, just a minute or two, then we'll stop recording and do some kind of housekeeping to finish up.
Well, the last thing that I'll say is if you are interested in learning anything more about connectors or getting connected to the connectors directly in your area, if you want that warm handoff, want that warm connection, hey, I'm in this county and I just want to know who to talk to, also reach out to me and I'm willing to do that direct connection for you so that you don't have to cold call somebody. So that's also available. And if you would like to become a connector. I'm telling you, it's really fun, so rewarding. Yeah, that's all. It just really is. So thank you all for your time today. And if you have any questions, I'll put my email in the chat. Feel free to reach out to me anytime or pass my contact information out to others too. Thank you.